Hello, everyone. I'm Tanya Rivero. Welcome back to CBSN's A Shot of Hope, Vaccine Questions Answered. Schools nationwide now have guidance for reopening safely. It is the first science-based national strategy, according to the CDC. But some critics say those guidelines do very little to actually help schools reopen. The CDC is recommending a color-coded system based on community spread of coronavirus. Schools in areas with lower transmission rates are blue and yellow zones where in-person learning is recommended. Red zones are high transmission areas with the most restrictions. Elementary schools can remain open, while middle and high schools are recommended to go hybrid or virtual only. Around 72% of schools currently fall into this category. Meg Oliver has more on the challenges many students and families continue to face.
Tanya, across the country, millions of students are still attending school only remotely, like here in Montclair, New Jersey, where the district has sued the teachers union for refusing to return in person. Another example is in Los Angeles. Next week, the teachers union there will vote to return in person. One of their demands includes vaccinating all staff first who want it.
It's frustrating. So frustrating. It's frustrating because trying to hold it together.
Renee Bailey has 2 children in the Los Angeles Unified School District, a kindergartner and an 8th grader with an intellectual disability. She desperately wants them back in the classroom.
Tell me how this has taken a toll on your son with the intellectual disability.
Intellectually, he's about a 3 or 4-year-old. So his attention span is roughly 2 to 3 minutes. So throughout the day, you're watching my son sitting there and punching himself in the face because he's so frustrated. And you'll just see the red marks, or if it's been a really bad day, you can see the blue marks on his arm from biting his skin.
Kids are suffering. Open schools now.
Parents in Los Angeles started protesting this week after the union refused to return, even after federal and local health officials said elementary schools could reopen.
All staff are either fully vaccinated or provided access to full vaccination.
Do you think vaccinating all of the teachers will help you reopen faster?
I would hope that it would help reopen the schools faster. But unfortunately, out here in Los Angeles, we've been dealing with a situation with the unions where it seems like every time we're to the brink of opening, there's another obstacle or a demand being thrown out there that pushes the date further and further.
For many children, as the pandemic has raged on, their mental health has continued to suffer. The CDC says between April and October, emergency departments saw a more than 30% spike in visits from children 12 to 17 years old for mental health reasons.
Do you feel the kids that are learning virtually, their mental health is declining?
100%.
Sherry Glassman is a school psychologist in Little Falls, New Jersey, where there's a hybrid program. Some students in person and others are virtual.
Virtual students are dealing with a lot of isolation, a lot of, screen burnout.
How many calls do you receive a day from parents worried about their children?
At least 5 to 10 calls a day, and it's all about mental health issues.
Dr. Maria Yarovi is a pediatrician in New Jersey. She said the calls she gets are about kids as young as kindergarten through college.
What are the biggest signs you should look for if you think your child is really struggling?
Not wanting to be involved in activities, not wanting to eat, just staying in their room, sleeping, not wanting to do anything.
In a September survey, more than half of children ages 11 to 17 reported they had thoughts of suicide or self-harm nearly half or every day in the previous 2 weeks. They were also more likely than any other age group to have moderate to severe symptoms of anxiety and depression. For families like the Baileys, they're not sure how much longer they can wait for schools to reopen.
How much longer can you hold on?
It's a day-by-day situation. It might sound extreme, but I love my house in Los Angeles. But I've already started considering moving to other areas that have taken the approach of reopening the schools, because this is a game that I don't want to play with my kids.
In addition to vaccinating teachers in LA, the union also wants a comprehensive safety plan, including PPE, ventilation, social distancing, and a cleaning regimen. Tanya?
Meg, Oliver, thank you. For more, let's bring in Alberto Carvahlo. He is the superintendent of the Miami-Dade County Public Schools in Florida, the nation's fourth largest school system. Superintendent, welcome.
Thank you very much for the opportunity, Tanya.
So you and your team in Miami-Dade were at the forefront of reopening schools during the pandemic. How has it been going for you so far, and what has been your model? Fully open or a hybrid?
We have been fully opened since October 5th. That means over 400 schools across the fourth largest school system in America, providing parents an option to send your children to school all day long or keeping them home and taking advantage of our virtual educational program, distance learning. And our community has been pretty divided. 50% of our students have returned to the schoolhouse. 50% of the parents have opted for a whole host of reasons based on workplace convenience, underlying conditions of the parents, students, or family members. But those parents opted to keep their children at home. Our experience has been reasonably successful. We've had good systems in place, guaranteeing transparency tools for the parents, contact tracing, vaccination of our 65 and older teachers. Now we're going to start vaccinating our 50 and older teachers, but around the clock, testing of both teachers and students in school site locations at no cost to anyone. In addition to obviously very airtight protocols and mitigation strategies, they are common to everybody across America, such as social distancing in schools, mandatory wearing of masks, electrostatic disinfection of buildings, single direction hallways and stairways, mandatory wash cycles of hands for students. If you have all these elements together, then you can, even in communities with a relatively high positivity rate, continue to have schools open for the benefit of students.
And Superintendent, the White House has reiterated that teacher vaccinations are not a prerequisite for reopening schools nationwide. Do you believe they should be?
So I don't think that vaccination is necessarily a prerequisite for students returning to schools for the reopening of schools, because we are prima facie example that schools can safely operate without people being vaccinated. We've been open since October 5th. However, with that said, look, teachers, school site personnel who have direct contact with students and the community are essential frontline, indispensable workers. So they should absolutely be prioritized for the coronavirus vaccine. I don't see why not. You have obviously health professionals being prioritized. You have individuals who live in nursing homes being prioritized because they are at special risk. I think those individuals who have functions are indispensable to our society, to our economy, who are frontline workers, should be prioritized next. The governor of the state of Florida has now prioritized teachers ages 50 and higher as part of next wave of vaccination. I believe we need to prioritize every single teacher, in addition to every single school site and direct contact personnel in schools, if we are to maintain schools as viably open for our students and their families.
And there is obviously a big debate over how to reopen schools safely, and each state is, of course, facing its own obstacles. What type of national policy would you implement if you were at liberty to do so? And would vaccines be at the center of it?
So I think the national policy that needs to be in place, number one, let's not forget the federal government has an important role in appropriating the necessary financial resources to states and local school systems for us to have the necessary PPEs, the necessary cleaning equipment, the necessary cleaning supplies for the long haul. Secondly, we need to liberalize a little bit, E-rate prerequisites for the expenditures associated with technology. We have learned during this pandemic how important digital connectivity, devices, and connectivity are for students and teachers alike. So there's a great deal of work that needs to be done in that regard. Next, I believe that in as much as the new CDC guidelines take us one step further in clarifying the appropriate conditions for return to school, I think those need to be considered on the basis of conditions at local levels. And I think the federal government has done a good job in this last rewrite of recommendations in understanding the regional variance of positivity and how systems can react to that. Ultimately, as you suggested, I do think that prioritization as far as teachers and school site personnel and direct contact personnel, that means the bus driver who picks up the child at home, the custodial staff, the cafeteria staff, teachers and paraprofessionals must be prioritized in terms of access to the vaccine if we are to ensure long-term continuity of learning in school as parents and students expect.
All right, well, Alberto Carvahlo, Superintendent of the Miami-Dade County Public School System, thanks for your time.
Thank you very much.
It's not just kids who have suffered from working remotely during the pandemic. Many adults also wonder when they will go back into the office. Some companies want that to happen soon. In fact, a number of well-known brands are incentivizing employees to get vaccinated, some of them even offering cold, hard cash, including McDonald's, Target, Amtrak, and Dollar Tree, among others. For more, I'm joined by Erica Pandey. She's a business reporter with Axios. Hi, Erica. Great to see you. So first off, we know universities across the country require incoming students to be up to date on a host of immunizations. Once vaccines are readily available, can employers require employees to get vaccinated for COVID-19?
So the short answer is yes. The EEOC has issued guidelines that say employers can do so, and you've seen like hospitals and schools do that have done this for a very long time. There are some exceptions. For example, if you have a medical issue or disability or sincerely held religious belief, you can, hold off. But the short answer, yes, employers can legally require their employees to get vaccinated.
And so if getting a vaccine becomes a condition for employment, what might this mean for those who would try and get a waiver? Could this open the gates for vaccination discrimination lawsuits?
Yeah, you've already seen this play out, right? There is a young woman in New York City who got fired from a restaurant she works at because she's not even against vaccines, but she wanted to just see if it affects fertility and pregnancy, which is, being studied right now before she goes ahead and gets it, and her employer fired her. So you could see people like this come back with lawsuits. The pandemic has already really caused workplace lawsuits to spike because people either don't feel safe going to work or they feel like their employer is taking away their freedom, making them get a vaccine. This is just going to add to that.
All right. The future is now. Erica Pandey, thank you so much for joining us. We appreciate it.
Thanks for having me.
Still to come, from teens and vaccines to when everyone will be able to get a shot. Dr. Anthony Fauci is back to answer more questions from our viewers. This is a CBSN special, A Shot of Hope. We're back in a moment.